Hi, I am Dr. Felice Gersh, your integrative OBGYN physician, here to talk about getting a good night's sleep, a continuous night of sleep where you don't have to suffer through middle of the night awakenings, typically around 3 a.m. Now, why is this happening? I know that there is at least a large percentage of you out there that this is a chronic issue for your life. Well, first of all, it really does matter because if you have a problem where you wake up, that's not a big deal. It's if you can't fall back to sleep. And typically, it would be defined as at least 30 minutes that you cannot fall back to sleep. That really can change the quality of your life and even the quality of your health status, because women who do not have a good night's sleep and they awaken around 3 a.m., it could be 2, it could be 4, but typically around 3 a.m., they have higher risk of having heart attacks and strokes, depression, fatigue during the day, poor work performance. They could even lose their jobs. They can have marital discord because they just lose patience. They're just irritable because they're always tired. Their enjoyment of life is really plummeting. So let's talk about the whys and then we'll talk about the what to do's. So why would it be that so many women are awakening around 3 a.m. and have such difficulty falling back to sleep? And by the way, it could be way more than that. It could be multiple times a night that there are awakenings and difficulty falling back to sleep. Well, one particular issue, which I'm sure crosses your mind right now, is during the menopausal transition, night sweats and hot flashes. About 80% of women will suffer from vasomotor symptoms. That's what we're talking about, night sweats and hot flashes. So these disruptions of the vasomotor condition involving the autonomic motor system, the autonomic system that controls everything we don't think about, which includes the thermoregulatory centers of the brain that control our temperature. Well, it happens that estradiol, that critically important hormone made by the ovaries, is produced in a sort of an erratic manner during the perimenopause, and then, of course, steadily down until none is produced when you're into the actual menopausal years. Well, estradiol regulates many things, including in the hypothalamus of the brain, what is called the thermoregulatory system of the body. Now, it's really important for the body to maintain a steady core temperature. That's the internal temperature deep inside your body. And to that end, estradiol will maintain that temperature. But what happens when you have a problem, when you don't have enough estradiol or it's erratic, fluctuating? Well, sometimes the temperature, the core body temperature, can start to fluctuate. Even a little bit of fluctuation is harmful. So the body does whatever it can to try to get it back to where it should be. So if it goes too low, well, then you would start shivering, okay? And you get cold. But if it goes too high, which is where it typically goes, then you start sweating, because the idea behind sweating is that you'll get the moisture on your skin, which hopefully would evaporate and lower your temperature. Well, sometimes it goes overboard and then your temperature drops and then you start having shaking chills. Well, you also get wet and your pajamas, your sheets can be soaking wet. So that is a huge problem that 80% of women deal with to some degree. Well, what if that's not your problem, but you also have this awakening problem? Well, there are other things that can be directly related to hormone levels. Well, if you don't have enough estradiol, you're not going to produce enough serotonin. That's the neurotransmitter that is known to make people feel happy and calm. And from serotonin comes melatonin, which I'm sure you've heard of. Melatonin is a hormone that has many very important functions, including sleep. There should be around 2 or so a.m. in the morning, a giant spike of melatonin, and that puts people back to sleep for the rest of the night. But if you don't make enough serotonin, which you won't make if you don't have enough estradiol, you're not going to make enough melatonin. You're not going to get that beautiful spike. to keep you asleep, and you are likely to wake up 2, 3 a.m. in the morning. And because you don't have enough melatonin and now you're feeling stressed, your cortisol will rise, which will make you stay awake. So it's a definite problem. Now, many of us live most of our daytime in areas where you're not getting enough sunlight. So one of the things that can also contribute to middle of the night awakening is not getting enough sunlight. It turns out that light is so important for our circadian rhythm to keep our master clock that sits atop the optic nerve in the area of the brain called the hypothalamus, to keep that master clock working on the beat so that you're in the right time zone, your brain is working on the right time zone, and all your organs are coordinated in the right time zone. But if you don't have enough sunlight, then you can have drifting of that master clock, and then you could be like mixed up about what time it is, and you can have a phase advancement where your brain thinks it's 6 or 7 a.m., but it's really 2 or 3 a.m. So getting a lot of sunlight first thing in the morning and midday can be really, really beneficial. Not only is it for the master clock, but it turns out that in the retina of the eyes, there are special sensors that pick up the light, and then there's a conduit, a nerve conduit, that goes from the retina in the back of the eye to the serotonin neurons in the brain to cause more serotonin to be produced, hence more melatonin and a better, deeper night of sleep. I'll bet you've noticed if you're outside a lot in the sunlight, you sleep so much better that night. Many of us work in windowless rooms, or the shades or the blinds are shut and there's no light coming in, and you might as well be working in a closet with bad kinds of light sources, that like LED lights, which are not good and that do not properly regulate our master clock the way natural sunlight does. So if you can't get enough sunlight, one of the things you can do is to get a light box, and it measures in what is called lux, and do 10,000 lux exposure of light, not that you're directly looking at it, it's like shining on you, for 30 minutes first thing in the morning and at least 30 minutes around the midday. And if you can, go out and watch the sunset. The colors of the sunset will naturally lower your cortisol level and encourage your melatonin to help you fall asleep and then stay asleep. Well, I mentioned night sweats and hot flashes. The best treatment for that is human bioidentical estradiol. So that will work almost 100% at eradicating these really disruptive night sweats and hot flashes. Now, what if for some reason, like breast cancer, you cannot take hormones right at that time? Well, there are pharmaceuticals. I don't want to get into them too much, but there are specific pharmaceuticals that can help with night sweats and hot flashes. So if you're one of those people that can't take hormones, then you should have a discussion. We'll talk about them more. We already have about the pharmaceuticals that can help with night sweats and hot flashes if you're not a candidate to go on real human bioidentical hormones. Now, I mentioned estradiol. What about progesterone? Well, what if you're a younger woman and you have irregular cycles? Or maybe you're on a hormonal contraceptive, say one that does, a pill or even an implant or an IUD that may interfere with your own ovarian function. Well, it turns out that our natural progesterone is also very important for sleep. The metabolite that's produced from progesterone, allopregnanolone, which I've talked about in a variety of circumstances, but when you have your own natural progesterone and you're making it properly, it will convert in the brain to the right amount of allopregnanolone, which binds to our GABA A receptor, which is inhibitory, and it helps promote sleep. So by having our own natural hormones, it can really help to keep you asleep through the night. Now, not every woman will experience night awakenings if she's on a hormonal contraceptive pill or some other hormonal contraceptive, but some will. So if this is a problem, then you need to discuss it with your healthcare professional to see if a different method might be better for you. So what else? Well, I mentioned light and I mentioned hormones. Well, what about movement? Well, it turns out that if you're very sedentary during the day, that also is a trigger to nighttime awakenings. If you're active, if you exercise, that is very conducive to a better night's sleep. So what if you can't get out and exercise and walk around all day long? Well, try to get a stand-up desk. Try to take a brisk walk at lunch or when you have breaks. Try to move as much as you can. The best time to exercise is in the earlier part of the day. In fact, if you do a great deal of exercise at night, it might actually increase cortisol, suppress melatonin, and interfere with a good solid night's sleep. So I always say we want to take exercise whenever we can get it, but if at all possible, try to exercise in the earlier part of the day. There's also data showing that yoga can also help promote a good, successful night of sleep. It turns out that there are some pharmaceuticals that can interfere and cause middle of the night awakenings. Probably one of the biggest ones is steroids. Now, sometimes people have to be on steroids like prednisone. Maybe they have an autoimmune disease that needs to be treated. Maybe they have asthma. So you have to take what you need, but these are some of the things that we sometimes have to face. Then we have to pull every other tool out of our toolbox, and we're going to talk about more of them. So there are other drugs as well. Some of the antihypertensive drugs can also be problematic. What about food and alcohol? Well, if you drink alcohol in the evening, like say with dinner, you will probably fall asleep because it is a sedating type of a substance. But there's this paradoxical awakening where people tend to waken at 2, 3 in the morning and have trouble falling back to sleep. So a lot of people think having a nightcap or drinking alcohol, wine with dinner, or having, some kind of an aperitif or after dinner, port wine or something is going to help them sleep. Actually, it may help them fall asleep, but it's not good sleep. It's not natural sleep cycles. And then you awaken. So we do not want to drink alcohol after like a lunch. I don't recommend alcohol for anything, but I know people do enjoy it, but please not at dinner. I know that's what people do, but if you have trouble with sleep, maybe pass on it or have just a few sips. It's not going to be good for your sleep. But what about eating? Well, many of us eat late at night. If you eat within 3 hours of bedtime, you're very likely statistically to have middle of the night awakenings. And if you have gastroesophageal reflux, you get heartburn, the worst thing you could do is eat late at night. Try not to have any food at least 3 hours before bedtime, and keep bedtime at the same time as much as you can, 7 days a week. The more erratic your bedtime, the more erratic your sleep will be during the night. So try to keep a straight, regular bedtime schedule. Now, there are health problems that can also interfere with sleep. Cardiovascular disease, hypertension, heart failure can have big impacts. Pulmonary problems where you have asthma or allergies or you can't breathe during the night. Make sure that if you are prone to allergies, that you make sure that you replace your pillow regularly, get dust mite covers. There's nothing worse than having your face full of dust mites when you're trying to sleep and you're having allergic reactions, which creates inflammation and can interfere with your breathing through your nose. Then you can start breathing through your mouth and then you awaken. So make sure that you have the most comfortable bed, non-allergenic pillows, preferably organic. You make the room really dark. I always sleep with a sleep mask, and I recommend all of my patients to do so. What if someone's in the bed with you who's making a racket, like snoring or moving all over, thrashing, having nightmares, which, by the way, if you have nightmares, that's definitely going to interfere with your sleep. But what if it's the person sharing your bed? Well, I hate to say it, but sometimes I do recommend a sleep divorce so that you don't have an old time divorce, because you get very crabby if you cannot sleep, or if you're up during the night kicking your partner to try to get that person to turn onto the side and stop snoring and waking you up, or so on, and that person is not going to get a good night's sleep. If you have a partner who does that, get that person to get a sleep study. But in the meantime, maybe if you have an extra bedroom, just get a sleep divorce. Get your partner to get properly treated if that person is clearly having difficulty getting through the night, him or herself. That is not good. But what about your sleep in terms of snoring, or you're having sleep apnea or sleep disordered breathing? When women go into menopause, the incidence of sleep disordered breathing and sleep apnea triples. So I recommend the vast majority of my patients who have any sleep problems to have a home sleep study. It's so simple now. We used to have to put these gadgets on our heads. It was quite uncomfortable. Now there's just a device that you put on your finger up to your wrist, and it can tell so many things. It's amazing about the kind of sleep you have, the sleep phases, when you're breathing through your mouth versus your nose. If you have restless leg syndrome, by the way, restless leg syndrome, definitely not good. If you have muscle cramps in your calves or elsewhere, muscle cramps in the calves is most common. If you awaken because you have muscle cramps, think of calcium, potassium, magnesium insufficiencies, and maybe use a calcium supplement, magnesium supplement. Make sure that you use maybe Mrs. Dash, which is potassium salt instead of sodium-based salt. Maybe you want to eat more vegetables, which have a lot of potassium in them. So we definitely want to think about having adequate minerals so that our muscles don't cramp up while we're sleeping. That is a definite awakening problem if you have muscle spasms in your calves and cramps during the night. And a sleep study, like I said, that should be on everyone's radar if you're awakening multiple times or even once during the night and you cannot fall back to sleep. What about depression? Depression is very prevalent in women at all ages, and especially during the perimenopause and menopausal years. During the 40s, the decade of the 40s, something like 25% of American women start on SSRI antidepressants. Well, depression itself is a cause for nighttime sleep disturbances. So if you have depression, or the other thing, anxiety, oh my goodness, a chronic state of anxiety will very much make it hard to fall back to sleep. And if you awaken, it's just, that's it, doomsday. You're not going to fall back to sleep because your mind is racing. You're thinking about all these things you're afraid of. If you have depression as well, it can be very full of nighttime awakenings and difficulty falling back to sleep. What about urinating during the night? A very common problem as people age. So one of the things that is actually a sign of sleep apnea is nocturia. Nocturia means going to the bathroom to pee in the middle of the night. So what can cause that? Well, I talked about if you have menopause, and perimenopause triples the incidence. Also, if you have obesity, if you have hypertension, just aging, all of these things can contribute to sleep disordered breathing and sleep apnea. So if you're having multiple times that you have to go urinate during the night, that is definitely a sign that you must get a sleep study. What else can it be? Well, maybe you have a urinary tract infection. Maybe you have very poor vascular system. You don't have healthy veins or lymphatic system, and you're getting edematous during the day. If you weigh yourself and you find that from first thing in the morning till when you go to bed, you have gained 5 pounds at least, or when you get up in the morning, you've lost 5 pounds from what your weight was the night before, that's a sign of fluid retention, okay? So that means that you very likely, assuming you don't have heart failure, I mean, I hope you don't have heart failure, but assuming you don't, one of the things could be that you have poor lymphatics or poor veins. You may want to get compression stockings for your legs and make sure you move a lot, because the more sedentary you are, where your legs are just dangling, the more you'll accumulate edema fluid outside of your vascular system in your tissues. And at night, when you're lying down, you can mobilize that, and then you just have to eliminate all this fluid all night long. So check for that problem, okay? So if you're going to the bathroom all night long, also think about, what are you drinking in the evening? Try not to have anything to drink for at least 3 hours before you go to bed. I don't want you to dehydrate. I want you to have plenty of fluid, but not in the 3 hours before you go to bed if you're getting up to go to the bathroom multiple times during the night. Of course, it's always a question. Are you waking up and then you have to go to the bathroom? Or do you have to go to the bathroom and that causes you to wake up? Sometimes people have trouble distinguishing which it is. But if you go to the bathroom and there's not much going out of you, maybe it's first you woke up and then you made you think that you should go to the bathroom. Light. If you have even a little bit of light in your bedroom, it can cause you to wake up. Remember, you're supposed to get that big spike of melatonin at 2 a.m. Well, what if you get a little spike? And then on top of that, you have some ambient room light. Maybe you have a little blinking light. Maybe you even have a night light. Maybe you have light coming in through the windows. That's why wearing a really good quality, comfortable sleep mask can be so helpful. Even a little bit of light coming through your eyelids can suppress melatonin production. So that's a really big deal. So we definitely need to keep all the lights out of our eyes, okay, at night. What about noise? Well, some people live on a busy street. There may be sirens, maybe a train goes by, maybe in the early morning there are big heavy trucks going by making their deliveries. Maybe there's neighbors who have thin walls in an apartment and they have babies crying and so on. Or they get up in the middle of the night and you can hear their pounding as they walk around. So if you have to, get something to put in your ears, earplugs of some kind, so you can't be awakened by lots of noise during the night and have a good night's sleep. That's where the neighbor can be a problem, but so can your bed partner be a problem. If that person is making noise, talking in his or her sleep, snoring, and so on, that's when you have to start thinking, if there's an extra room of the sleep divorce, plus get that other person some help as well, because that's not good for health. Remember, if you don't get a good night's sleep, you increase your risk of diabetes, strokes, heart attack, depression, dementia, obesity. Need I say more? Sleep is not optional. Also, your immune system does all kinds of wonderful things while you're sleeping, and you need to have that revved up immune system so you don't get sick, especially as you age. You have immunosenescence. Your immune system gets old. We don't want it to get older before it has to. We want to keep it working optimally. Also, it's during the night that our lymphatic system in our brain is clearing out all the junk from our brain. But if you're not sleeping, it's not working. So we definitely have to do everything we can to get an adequate night's sleep. So it's so important to have the proper sleep hygiene, the right ambiance. Keep the room as cold as you possibly can and tolerate it. It's better to put on more blankets and maybe wear some warm fuzzy socks and keep the room as cold as you possibly can. You can't spend, $500 a week on electric bills because you turn the air conditioning down to 60 degrees. But get a fan. That's what I have next to my bed, a really nice fan that is always blowing on me. It always feels like an ocean breeze coming. Plus, I like the little white noise kind of sound, the little sound of my fan. I find it very comforting and soothing. Don't go to sleep with a television on. Don't do it. If you have to have sound, use something like a sound coming from a recording, whether it's a podcast or a books on tape, something like that, where there's sound, no light, okay? Try to listen to music rather than a lot of talking, but if you have to have talking, don't make it on television. Make it on a radio or your cell phone, but don't put your cell phone where the light is visible. If you have to hear something from your cell phone, put like a towel over it so that there's no light coming from it, because you do not want that light, even a little bit. And the light from a television is terrible. I can tell you, I know of so many people, they have a television in their bedroom, they turn it on and they fall asleep with it on, and it's on most of the night. So very bad for your quality of sleep. In fact, I discourage having a television in the bedroom, but if you must, please turn it off long before you go to bed. At least 2 hours, please. In fact, fewer screens before you go to bed, the better. If you wake up during the night, please don't look at your cell phone. That light will help you to stay awake, but that's not what you want. You want to go back to sleep. Now, I'm going to give you a little trick, okay? This is a cognitive behavioral therapy trick. Now, cognitive behavioral therapy is one of the best therapies for treating nighttime awakenings. So ask your healthcare professional for a referral to someone who can work with you with cognitive behavioral therapy. But here's one of their tricks. If you wake up during the night, you go to the bathroom, you come back to bed, you didn't turn on any lights, you didn't look at your screens on your cell phone or anything, and you lie down in bed and you just can't fall back to sleep. So what do? The first thing you can do is some progressive relaxation. You tighten your fists and then you relax it. You tighten your all the way up to your elbows, then you relax it. You go through all these different muscle groups until you're tightening every muscle in your body and then relaxing it. Then you could do the breath work. Do this at least 5 times. You breathe in through your nose for 4 seconds, fill your lungs. Hold your breath for 7, and then blow out through your mouth, making a whooshy sound for 8. So it's in 4, hold 7, out 8. You do that at least 5 times. Then, with your eyes closed all this time, you go and start at the beginning of the alphabet, A. And then you can do the following. You can do other ways. You pick any food. So you close your eyes and you say A, apple, B, banana, C, cupcake, D, donut. You get all, good, just go through. What if you get to H and you can't think of anything? Then you could just say helicopter. Doesn't matter. This is not a test. You just, if you can't think of a food, just say anything that starts with that letter, a name, anything, doesn't matter. Most people will fall asleep before they hit letter L. I've done this a load of times. It's amazing. Apparently, when you do this, it puts your brain into a state that is pre-sleep state. And most people will fall right to sleep. What if you get through the whole alphabet? Rarely happens, but if you do, go back to letter A, and then this time pick an object that's not a food, or you can pick a different food. Just then work your way through the alphabet, like you start with A, airplane, B, boat, C, cat, whatever. You can just go through the alphabet. If you can't think of something, just make up a name. Like you get to H, can't think of anything again, say Helen, whatever. It doesn't matter. Okay? And usually you'll fall asleep once again before you get to the letter L. These can really change your life. Remember, hormones, number 1 for night sweats, hot flashes, and not just that. We know that it helps you make serotonin. It helps you be calmer, so it helps with depression. So there's so many benefits. I go on and on about all the benefits of hormones. And then we have the cognitive behavioral therapy, these little techniques, not to have light, to be calm, to not eat, to not exercise and exercise earlier, get plenty of light. All of these things can be game changers. Sometimes you have to do them all. And if you need a professional in sleep management, whether it's a therapist for a cognitive behavioral therapist, a sleep specialist to look at if you're having other problems involving sleep disordered breathing, then you go get it. I didn't mention that, maybe you have a problem with your neck and you have big tonsils or a big thick palate, and you need to actually see an ear, nose, throat doctor. Maybe you need a dental device. Maybe you need even a surgical issue involving your tonsils or your palate. Seek professional help if all the little tricks I told you are not helping. Because sleep, not optional. Waking up on and off during the night, not conducive to optimal health or quality of life. And all of you, get a good night's sleep.